Hello, I'm going to talk about my research project, which is about the impact of vitamin D on disease activity in Crohn's disease patients. First, what is Crohn's disease? What is inflammatory bowel disease? These diseases are characterized by chronic inflammation and idiopathic relapsing disorder, and it refers in for Crohn's disease and ulcerative colitis. The difference is the location of the disease. Crohn's disease affects the digestive tract from mouth to ends, and ulcerative the colon only. And this picture is show that the difference between Crohn's disease and ulcerative colitis. The prevalence of inflammatory bowel disease in Canada is the highest rate in the world, and also in Saudi Arabia we see that the significant increase of the incidence of Crohn's disease than ulcerative colitis in the last 10 years of a study. And in this graph you can see that the increase of Crohn's disease than ulcerative colitis in the last 10 years. So, what's the etiology of Crohn's disease? The exact etiology is unknown, but some people say that it could be genetic reason or immunologic or environmental factors such as smoking, secondhand smoking, less exposed to infections. So, this is the clinical presentation of Crohn's disease patients. There are common symptoms and extraintestinal symptoms. How can we diagnose Crohn's disease? We have lab tests such as C-reactive protein, which is the most accurate one, and we have endoscopic and imaging X-ray, and we can do stool test like a sample from fecal calprotectin sample, but this tool is for research only. And also researchers can use Crohn's disease activity index, which indicates that people who have more than 150 score, they have active disease, and less than that they are in remission. So what is the treatment of Crohn's disease? There is no cure for Crohn's disease, but the short-term goal is providing medication to control the symptoms, and a long-term goal is maintaining that remission, to be in remission. So, some people can get medication and others can have surgery or resection surgery. And also, as a nutritionist, we have nutritional therapy. For example, omega-3 fatty acid, folate, calcium, vitamin D, and vitamin D3. Also, we have a lot of study shown that vitamin 3 decrease the disease activity in Crohn's disease patients. So from this point, I build my research on vitamin D, on the relation between vitamin D and Crohn's disease. So I found the first article that's shown that high dose of vitamin D intake may have health benefits that can prevent relapse of Crohn's disease. It was a randomized placebo-controlled trial conducted to examine the benefit of vitamin D3 therapy on Crohn's disease patients in remission. The intervention was 1200 and placebo group. They found that vitamin D3 increased the level of vitamin D in blood from 69 to 96, which is great. and lower Crohn's disease activity index and serum reactive protein, C-reactive protein associated with patients who receive oral vitamin D supplements. Another study shown that uh, vitamin D2 is less active from vitamin D3, and they show that Crohn's disease activity index and C-reactive protein decreased dramatically after 6 weeks, and this effect disappeared at 12 months. So the effect, it was in short term, just in short term. So I actually didn't find a study showed that the effect of vitamin D in long term, like more than 1 year. So another study showed that 100 from international unit per day of vitamin D intake from diet and supplements decreased the disease activity 7%. Another study shown that 24 weeks of supplements up, up to 5,000 per day of vitamin D raised the serum of vitamin D and decreased the score of Crohn's disease activity index in Crohn's disease patients. And the most interesting study, it was a randomized trial aimed to determine if high dose of vitamin D3 supplementation in vitamin D deficient patients with Crohn's disease lead to improved clinical outcomes. They had two groups. One, they give them 1,000 international units per day, and the second group 10,000 international units per day, which is high dose, and more than 10,000 it could be toxicity. They assessed the vitamin D level at the first day and after 10 weeks and after 26 weeks of treatment. And they found that after 26 of therapy, the low dose group, which is 1,000, had no significant change in disease activity, but the other group, which is 10,000, they did. So, from my literature, I found that we don't know the effect of high dose of vitamin D3, like 10,000, on disease activity in Crohn's disease patients in short term under different environmental factors. So, my study objective is to determine vitamin D status and disease activity in Crohn's disease cases in Canada and Saudi Arabia, and also to evaluate the impact of vitamin D in doses higher than RDA on disease activity in Crohn's disease patients. And my primary outcome is the changes in disease activity on each 3 doses of the different groups, and the second outcome, vitamin D status and health related quality of life. And my study design and methodology, it's a double-blind randomized controlled trial for 60 active Crohn's disease cases in Canada. We have 30 in Canada and 30 in Saudi Arabia. We divided 10 each group, and the first group will take 400 international units of vitamin D, and the second group 2,000, and the third group 10,000. And we will measure the vitamin D in baseline and after 9 weeks of treatment. And I will follow up after 2 months of treatment. Our inclusion criteria is recent Crohn's disease patients. They are active patients, active Crohn's disease, and age from 16 to 40 years old. And we will assess them by demographic, socioeconomic questionnaires, and 24-hour dietary recall, and physical activity questionnaire, and health-related quality of life questionnaires. Also, lab tests such as C-reactive protein, CBC, WBC, vitamin D, and fecal calprotectin samples and Crohn's disease activity index. So I hope that my research it will be successful, and I want to acknowledge my supervisor and my committee members and all my and acknowledge also Aerofarm and University of Saskatchewan and Ministry of Higher Education in Saudi Arabia and King Khalid University Hospital in Riyadh. Thank you.